everyone, Leslie Cornwell, Midwifery Business Consultation. I wanted to talk to people about billable charges outside of standard maternity care. So that billable code 59400, so many midwives just bill that, but there's so much more we do part of our services, our scope that we're not getting paid for. And that's part of that additional services we offer compared to a traditional OB family practice office to do a delivery at the hospital. So there's so many billable charges. That's typically if there's a birth center, a home birth practice that's billing insurance, wanting to increase their revenue, wanting to make their numbers work better on their business plan, on their income and expense sheets. The first thing I always go to is looking at what services are you rendering and what are you charging for them? Are you charging, is there simple things that there's lost revenue for services you're offering, but you're not charging to the families a non-covered service, or you're not charging to the insurance company on a claim. So that's something simple that can be started instantly. It can be retrograded, many insurance companies 6 months to a year. So that's a simple way to increase revenue for a practice and to give credit for all that qualitative, all that amazing time you're spending with family. There's value to that. So some of the more common outside of maternity care charges that I look at when I do a report audit is primary care. So are you charging outside of a prenatal visit? Somebody comes in for an ear infection, somebody comes in for any sort of care outside of standard maternity, that's a billable service outside of their prenatal care. There's certain codes, there's certain documentations you have to use to submit with it, but it's definitely payable. So if they have a flu, they have an earache, they have an asthma attack, I mean, all those primary care things, if it's not their scheduled prenatal visit and they need to be seen for something outside of pregnancy, definitely get reimbursed for your time. Newborn care, some people will count it as part of their cash global rate, but with the Affordable Care Act, it's so nice to get covered for preventative services, that initial newborn exam, follow-up newborn exams, if you're doing the day 1, day 5, and the 2-week visit. Newborn care is part of the scope of a midwife for the first month of life. Supplies, medications, even if it's just a few dollars here and there and you're already submitting a claim, some people will say to me, well, a vitamin K, I get paid like $1. And I'm like, if you're already submitting a claim for all your other charges, it takes you 10 seconds to add that to it. Every dollar, when you're seeing 10, 15, 20 people, especially a larger practice, it really adds up. So those are important things. Every little piece of care, the birth assistant, the tub rentals, the facility fee, the one-on-one labor support, if there's a complication during labor, a newborn resuscitation, a postpartum hemorrhage, IV supplies are used, an ambu bag is used. Give credit for all of those services you are providing. They're separate, identifiable procedures outside of standard normal birth. So just think about your practice, think about how you're billing out to your insurance companies, how you're billing out to your families. My financial fee schedules would have broken down what was non-covered by their insurance plan and what was a claim sent to the insurance company. So there may be some things you know for a fact no insurance company will pay, but I put on my financial agreements, I put on my fee schedule, those clear expectation of what those services are that you offer. And you can't promise people what their total charges are going to be at the beginning because you can't predict what care is going to be done. So giving them a good education from the beginning, expectation, this is a standard OB code that's charged, but if you come in for me for this, if this complication happens, any service that's provided by me is a service that is billed outside of the global maternity. So having a clear expectation from the beginning, making sure you know what charges you can do outside of global maternity. I loved doing like the prenatal risk assessment the first OB visit. There's a form for that. There's a code for that because we're already doing a risk assessment to decide are they a good candidate for out-of-hospital births. So you might as well get paid for that. If you're doing lots of counseling, you're doing lots of education. So there's tobacco screenings. Preventative education is huge with the Affordable Care Act. So depression screenings, we do them throughout pregnancy, we do them postpartum. Mental health is huge this year, huge. And so reimbursement is increasing with those things. Other like nutritional, if there's weight management, if there's diabetes, there's education going along with diet and exercise. There's actual nutritional counseling codes that you can use. The other thing I like to stress is if your practice is having doulas or doing directly a childbirth education course, there's a lot of codes you can do for newborn care, breastfeeding support, and the childbirth education classes that they can build to their insurance. So think about all your things in your practice. This is something that's so simple for midwives to implement, and I would love to help out. The other great thing is we have a billable course, billing and coding course that you can take that talks more into detail some of these common missed billable charges. What are all the aspects of services you can bill for to get the reimbursement you deserve for your practice?